Medicare enrollment made simple. Welcome to Medicare Enrollment Periods and Eligibility. My name is Joe Valenzuela, here from Vista Mutual Insurance Services, where we try to simplify and demystify Medicare. Today we're going to be talking about enrollment periods for various products, including Medicare itself, and just to give you a little bit of insight on how these things work. So, to understand enrollment periods, though, you do have to have a little basic knowledge about Medicare itself. So just really quickly, Medicare Part A is your hospital insurance. Medicare Part B is your medical insurance. These are what are considered original Medicare, and they come directly from the federal government. In order to be eligible for Medicare itself, you have to be either 65 or older and have worked inside the United States. Now, if you didn't work for 40 quarters and pay FICA taxes during that time, then you actually may have to pay for Part A. Most people don't pay for Part A. Most people do pay for Part B at $164.90. That's the baseline premium. So this is original Medicare. Okay? The eligibility requirements, again, are that you have to be a United States citizen, that you have to be 65 years or older, or you can have a disability. There are certain disabilities that will allow you to get your Medicare sooner than others, but in most cases, you have to be disabled for 24 months. So permanently disabled for 24 months. And on that 24th month, you get disability just like somebody that's over 65. My youngest client is actually 22 years old. My oldest client is 104. So you don't necessarily have to be older to get Medicare. Also, for people that have ESRD, end-stage renal disease, which is kidney failure, or people that have ALS, Lou Gehrig's disease, they get their Medicare a lot faster than someone that has a permanent disability that's not those things. Okay, so there's also Medicare Part C, which is Medicare Advantage plans. Now, these are plans that take over for your Medicare, usually are low costing but have co-payments as you go. And there's also Medicare Part D. Those are the four basic parts of Medicare. Part D is for your prescription drugs. So we'll go over all of the eligibility requirements and enrollment periods for each. So the initial enrollment period lasts for 7 months. This is a period where you can do almost anything and where most people do everything. So 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after, you have your initial enrollment period or your IEP. During the 7-month period, you can enroll into Medicare. Now, if your birthday is any time during the month, it goes back to the first of the month. So let's say, we're in July, it's July 4th, that's your birthday, you would get your Medicare July 1st. Okay? So when you're going to enroll into Medicare itself, you have to, if you're collecting Social Security, it would be automatic. You don't have to do anything. So if you're currently collecting Social Security at 65, we're finding that most people are not currently collecting because they're waiting for that higher value. So if you're not collecting, then you're going to have to self-enroll. You'll have to go to medicare.gov or to Social Security or SSA.gov and enroll yourself there. You can also go into a Social Security office or give them a call and they'll send you a packet, but it is up to you to manually enroll if you're not collecting Social Security. Now, if you're collecting Social Security, they're going to enroll you about 2 months before, send you your card. And if you didn't want Medicare, you'd have to say, I don't want Medicare, and have to sign a form saying that you'd like to delay your Medicare Part A and Part B. And now during this initial enrollment period too, you also have the ability to enroll into a Medicare Supplement or a Medicare Advantage plan. These periods happen at the same time, and again, most people get this done within that period of time. So during that 7 months, you can activate a Medicare Advantage plan at the same time. You can activate a Part D plan at the same time that your Medicare goes effective, and you can also activate a Medicare Supplement plan. We're going to get into more details because there are different rules for each. Now, let's say, and this happens sometimes, that you miss your initial enrollment period for just Medicare itself, just to get in Medicare Part A and Part B. Let's say you weren't collecting Social Security, you have to self-enroll, and something just went wrong in that process. It happens. So Medicare allows for the general enrollment period, which happens between January and March 31st. There's also another period that happens during this time. This is specifically for Medicare Part A and Part B. So if you miss your window every year between January and March, you can enroll into Medicare. Now, usually, though, there's going to be a penalty if this happens, and your Medicare is not going to go effective until July 1st. So there's a lot of penalties regarding these enrollment periods, so it behooves you to speak with an insurance agent like myself or one of my agents to just talk about your timeline and how this stuff can work for you. Now, there's also the annual election period. And the annual election period happens every single year between October 15th and December 7th. Now, this period is specific to Medicare Advantage plans, right? So Medicare Advantage plans are those plans that replace your Medicare coverage, usually are very low costing or zero, and also include some ancillary benefits and have co-payments as you go. Incredibly popular plans. So they're offered by private insurance companies, right? So companies like Humana or United Healthcare, just examples. And they do provide additional benefits in the ancillary side, as well as usually include prescription drug plans and coverage for dental and vision. Okay? With Medicare Part C plans, whatever you have during the year, let's say that you have just original Medicare, no other plan, and that annual election period rolls around October 15th, you can enroll into any Medicare Advantage plan that's offered in your county or your zip code. Sometimes they're offered in just zip code, so it's important to speak with an agent to see what's available to you. Or you can go on medicare.gov and also you can see that. So even if you enroll, though, on October 15th, that coverage does not become effective until January 1st of the next year. And the same thing happens if you enroll on December 7th. That coverage becomes effective January 1st of the next year. This is, a huge time for Medicare brokerage and insurance agents like myself, that we do about 70 to 80% of our business during this time, kind of like tax season for a tax person. So before this too, you're going to get an annual notice of change. It tells you about, if you're currently on a plan, it'll tell you about all the changes that happen to that plan, because there are changes that happen every single year. Okay. So that's as it pertains to Medicare Part C. There's a couple other periods that pertain to that as well. There is the MAID OEP as well. This happens at the same time as the general enrollment period for Medicare itself. Now, what this period is for is it's not for people that just have original Medicare or people that have original Medicare and a supplement plan. You can only use this period if you currently have a Medicare Advantage plan. So if you have the Medicare Advantage plan and you want to switch to a different one, you have a period between January 1st and March 31st where you can make one change. They instituted this because some people, it's the enrollment period is towards the end of the year. There's a few holidays that happen during that time. So some people miss it. Also, some people enroll into a plan that after a few months, they find out they do not like. So they give them the ability to switch back one more time. But again, the caveat here is that you have to have a Medicare Advantage plan in order to use this period. If you have just original Medicare or original Medicare and a Part D plan with a supplement plan, you cannot use this period to switch over. You have to wait until the annual election period, October 15th through December 7th of every year. That is subject to change. It has changed in the past, but it's been that way for about 12 years now, so we don't anticipate any changes there. Now, there is also special enrollment periods. These are, again, for Medicare Advantage plans, and these happen when, let's say, you move from one county to another county. Well, these plans are only offered per county, so the plan that you have may not be offered in the county that you move to. So Medicare allows you a special election period in order to get a new plan in your new county, and it usually lasts for about 60 days, but most people sign up before they get into the new county so that they can have their insurance there. That's one. Another one that's very popular is when people are coming off of group coverage. We see a lot of people working past age 65. And if you're coming off group coverage and you're outside of an enrollment period, that's okay, because you have a special election period in order to enroll into a plan for up to technically 8 months after you come off of a group employer or even COBRA coverage. So that's another one. There's if you're institutionalized, you get a special election period to pick up a plan that's different than you currently have, because sometimes you're moved from county to county there as well. So there's a lot of special enrollment periods, special election periods that allow you to get a plan outside these traditional enrollment periods. Now, there are other enrollment periods for Medicare Supplement plans. Now, there's two roads that you can really go down where you're getting this type of insurance. One is a Medicare Advantage plan, and the other is the Medicare Supplement plan. So if you're going with the Medicare Supplement plan, the enrollment periods are slightly different. Again, you can use the initial election period to activate a Medicare Supplement right away, or you have up to 6 months from your Part B effective date in order to get a Medicare Supplement guaranteed. Now, Medicare Supplements work a little bit differently than Medicare Advantage plans in the sense that they can medically underwrite you. It's one of the only insurances left in the U.S. that can medically underwrite you, meaning they can ask you health questions and possibly deny you coverage based on your current health situation. Now, during the first 6 months after your Part B is active, they cannot do this. You're guaranteed onto a plan. So you have to make your decision within that amount of time. Now, also, let's say that you picked a Medicare Advantage plan first. It's the first plan that you've ever chosen. There's a rule that you get 1 full year to decide whether or not you like that, and you can still choose a Medicare Supplement. You can also use this rule reverse. Let's say that you've got a Medicare Supplement for the first time. You've had that for a couple of years. Now you think, well, I'm spending a little too much money on this supplement. I'd like to go to a Medicare Advantage plan. During that first year that you've switched from a Medicare Supplement to a Medicare Advantage, you're able to go back to that Medicare Supplement, no questions asked. It's called a trial right period. And it does happen sometimes. It's not very often. It's kind of rare that people do go back and forth, but just know that you have that amount of time, pretty much your first year on any coverage, to decide whether or not you like it. Now, after that, then you have to abide by all the enrollment periods that we've just talked about. There is also a longer period of time if you're coming off of group employer coverage that you can get a supplement for. So it just depends on your situation. This is most of the enrollment periods, but there are more of them, and especially in the special election or special enrollment period category. We just wanted to give you a good baseline of knowledge about when you can enroll into Medicare and when you can enroll into Medicare Advantage and Medicare Supplement plans. We want to bring you the world of Medicare in a very simple and easy way to understand. So please like, subscribe, comment, and ask questions so that we can continue to bring you this great content. From Joe Valenzuela and Vista Mutual Insurance Services, thank you very much. Have a great rest of your day, and I'll see you soon.